today I'm here to present that you are our 2023 National Caregiver of the Year.
National award winner. Ooh, girl.
My reaction when I found out that she was going to be the national champion, I was just so thrilled for her, so deserving for her.
I look at her and I go, when I grow up, I'm going to be a nurse just like her.
Oh, no, you couldn't have picked a better person.
She's an excellent nurse and an excellent employee, and probably a better human being than she even is a nurse.
Good morning, Phyllis. It's Audrey.
Hi there, Audrey.
Hey, good morning.
We hit the road and we're going to the first client.
We are on our way.
All right, sounds good, my dear.
Okay. See you then, hon. Doing a good work and treating others the way you would like to be treated or you would like your mother to be treated is really important to me. And I feel like my nursing career has allowed a venue for that. Phyllis, hello.
Doing our assessments, providing the care that they need. And that's the pattern, a couple visits every morning and a couple visits every afternoon.
I've known Audrey since 2019. She was a nurse on staff when I started my QA position and has been there since. She's a delight to work with. Anything you ask her to do, she does.
When I go into my patients' homes, I get to see their environment and what surrounds them. When you're working with patients in their homes, you need to know what are their resources. How do they function in the context of their home?
Now, Audrey is probably the primary reason right now I'm still independent.
Hi, Vanessa. My name is Audrey. I'm a home health nurse with the Good Samaritan Society.
Because she has worked with me on that.
I am visiting with Phyllis Hayworth this morning to set up her med box.
I'm just so pleased that I just don't think you could have done a better person. You gotta let everybody know that.
All right, thank you. I also kind of like being able to take care of one patient at a time. I do not mind driving. It's time to make the transition from one visit to the next and get my head square for the next visit because our patients are very different from patient to patient. So I just like to kind of review, okay, what do we need to do today?
Andrea.
She has been the rock for this agency for the past 4 years. She really has.
I kind of feel like I was led to, that I was made for this.
She's a good nurse. She has a good sense of humor. It's very good.
She's done every nursing clinical orientation for any new employee who's come through my agency since she was hired.
Nursing obviously is very challenging in many very different ways. You have to pay attention to a lot of details.
She is the constant on the nursing side.
You're sounding better.
She's the go-to clinically. She really is a very valuable member of this team. Not replaceable.
Hi, Nicole. Now that I'm comfortable in this role, I have to say that this is the first job that I can ever say that I love. I do love my job.
Congratulations. I appreciate you in more ways than you know on a professional and a personal level. Well deserved.
We can't say it enough. I mean, Audrey's just amazing in what she does.
The tale of the Good Samaritan is near and dear to my heart. That's an image of compassion, not that I'm necessarily that person, but I like representing the ideology behind the Good Samaritan. I like that image of being the feet and hands of God.
You're a sweetheart. Oh, thank you. And again, I think this is just marvelous.
I knew you would celebrate this with me.